Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in mindfulness therapy, and I offer online therapy via Skype for mental health. When we talk about mental health here, we're talking about non-clinical conditions such as anxiety and depression, or OCD, or PTSD, or any other form of emotional suffering that can benefit from mindfulness therapy. So it's about helping you develop more well-being, a sense of being at ease, being able to process the ups and downs of life more effectively without becoming emotionally overwhelmed. And really that's the definition of mental health, is being able to process experience without becoming stuck in an emotional state that doesn't resolve itself, such as chronic depression or chronic anxiety, such as with an anxiety disorder, like agoraphobia. I see lots of people who suffer from agoraphobia because, of course, it's very convenient for an agoraphobic to get help from an online therapist. It's much easier than trying to arrange to go to a therapist's office. Another group of people that I have helped considerably over the years have been people suffering from driving phobia or extreme driving anxiety. This is another limiting factor that makes online therapy very attractive. Perhaps the greatest important thing to consider when you are looking for an online therapist is that they offer therapy via Skype. You must be able to see each other as well as talk to each other in real time. If you can do that, then basically it's no different than meeting a therapist in person for the vast majority of cases. Many of my clients actually greatly prefer online therapy, not just because of its convenience, but also because it feels more comfortable. You will feel more in charge of the process. And this is an important factor because you need to be learning how to manage your emotions more effectively to achieve optimum mental health. And that means putting you in charge. So I don't advocate treatment-based approaches or medications because they do not put you in charge. They do not teach you skills for more successfully managing life experiences. So in mindfulness therapy, we focus very much on teaching you practical skills that you can apply yourself to work with your emotions and to break free from those underlying psychological habits that cause anxiety or depression or OCD or PTSD. In the case of anxiety, what happens is that these underlying psychological habits get triggered by events or situations or thoughts. And when they get triggered, they proliferate and create the anguish of emotional suffering that has the effect of limiting your state of well-being and also limiting your quality of life and the quality of your work and your relationships as well. So it's a mechanism that operates in the mind, and that needs to be addressed fully, and medications cannot do that. They can only treat symptoms. So in mindfulness therapy, we focus very much on these underlying emotional habits, and we bring consciousness to them. That is what mindfulness is. After all, it's a form of non-reactive consciousness that sees directly what is there in front of it. So if we're looking at an emotion mindfully, we are not reacting to it. We are able to be totally present with that emotion and explore its structure to see how it works. And the more you see, the more you can change. And that's one of the reasons why mindfulness therapy is so effective, because it focuses on seeing more about how your anxiety or depression actually work. We look, first of all, for the cluster of related reactive thoughts that feed the anxiety or depression. Patterns of rumination, patterns of chronic worrying, where we become identified with these thoughts, where we become swept away by these reactive thoughts, and essentially become a prisoner of reactive thoughts. We also look at limiting beliefs as well, another set of thoughts that we tend to identify with and that tend to feed anxiety and depression and limit our mental health. So breaking free from limiting beliefs is a very important part of mindfulness therapy. So if you'd like to learn more about this approach, and you like the idea of online mindfulness therapy via Skype, do please contact me so we can schedule a session. Most people find that this very practical mindfulness-based approach produces results in a relatively short time. This approach is quite different than conventional counseling or talk therapy. It's very practical, very hands-on. And because of that, it gets results very quickly. And I always say that you should expect to see significant improvements in your state of well-being and mental health within 3 to 4 sessions once you start applying the mindfulness methods that I will teach you. So if you'd like to learn more, please don't hesitate. Reach out to me by email. Ask any questions you may have about online therapy and about how I can help you with your specific needs. When you feel ready, we can schedule a session, and then you can see for yourself just how powerful it can be when you start applying mindfulness to working with your emotions. So, if you'd like to start mindfulness therapy via Skype with me, do please contact me now. Thank you.